And so, what role has harm reduction played in helping to offer a service that is accessible, that is culturally responsive, and is trauma informed?
So basically, when victims are living in our shelter, they are away from their abuse or their hectic, chaotic environment. So when they are free from this kind of harm, mentally, physically, and emotionally, they're better prepared to work on connections between violence, trauma, and their substance use disorder if they have one. So with this, it gives them a sense of tranquility, stability, and a sense of direction so they can solely focus on achieving their goals through our services, whether that's through individual or group therapy, whether that's planning for departure, anything like that. And so from this, they practice this self-autonomy where they can amplify and boost their self-confidence for wanting better and doing better. Do you want to add anything, E, to that?
No, you said that perfectly.
Yes. And sometimes it's interesting, right? Like sometimes harm reduction can seem um, like not a good fit or maybe even scary for some folks. And yet we see also that when people are stuck in kind of an all or nothing approach, that can also just cause its own kind of harm. And so if folks are, obviously there's a lot of ways to talk about harm reduction without even talking about harm reduction. Harm reduction is our daily life, right? Like when I put on the seatbelt, it's harm reduction. And so what are some ways that you kind of engage people who are accessing your services and just thinking about kind of just supporting that any positive change?
So first, I always assess the client's safety, number one, and their needs for what they want to do in life. So when we have these one-on-one sessions, we usually utilize these sessions for harm reduction, improving their lifestyle and making any changes that they would like to work on. So it's basically solution focused and client center focused. And so when it comes to therapists and clinicians between the main office and the shelter, we basically like to have the client practice self-autonomy, as I mentioned before, because we want what the client wants. Hopefully that's in a positive manner. But yeah.
Yeah, absolutely. That when we're really focused on those self-defined needs and focused on survivor autonomy, that kind of everything we do ends up falling within harm reduction in one way or another.
Pretty much.